anyways, we want to thank you guys for joining us. And we today are talking about busting mammogram myths. So here from FemHealth, we love to give you evidence-based content about women's health. And we have a very special guest, Dr. Anjali Malik, who's here with us, who's going to tell us all about the things that we worry about mammograms. Are they real? Are they fake? What should we do? So I think first off, what I really want to know is, there's so many different guidelines. They change all the time. Who needs a mammogram? How old do you need to be and how often you need to get one?
Yeah. Hi, everyone. Thanks for having me and thanks for tuning in. So for those of average risk, we recommend annual mammograms starting at the age of 40. So what does average risk mean? What do we mean by that? So you hear the statistic that 1 in 8 women will develop breast cancer over the course of her lifetime. And that is the average background risk. So all of us are at risk for the development of breast cancer just by being female and aging. Those are actually the top 2 risk factors for the development of breast cancer. And so as long as we have those, we need to be getting an annual mammogram starting at the age of 40. Now, for those who might have other risk factors, such as not just family history, but early family history or premenopausal, which is considered any breast cancer before the age of 50, have a family history of male breast cancer, like, Beyonce, or have a known genetic mutation, et cetera. For those, what the American College of Radiology recommends is that a risk assessment be performed before the age of 30, so that if a high-risk screening protocol needs to be utilized, or if genetic testing needs to be obtained, that can happen early, so that that high-risk screening can be happening before the age of 40. But unless that high-risk screening is needed, annual screening mammograms at the age of starting at the age of 40.
That's really helpful. And 30 is a good, I would not have known of that. So if you're at risk, like, get evaluated, get your risk stratified before the age of 30. So another big myth is that mammograms are super painful. And right. I want to get your take on it, and I'll give mine because I've had one before. Actually, I've had 3 before. So I definitely know what it feels like.
I had one yesterday, so I do practice what I preach. Yes, is it, it's not like going to the spa, unless you're thinking about, a deep tissue massage that really gets out those knots. But yes, so one of the barriers that we hear about women obtaining their mammogram is pain. And that is because a mammogram compresses the breast tissue so that we can get all the breast tissue to spread out to see if there are any cancers or anything inside the breast. So it is a few seconds of compression per breast, typically 2 images per breast. So a total of 4 images. And overall, we're talking about, under a minute of compression. So it is extremely quick. Overall, in my opinion, worth the benefit of early detection for breast cancer screening. So there are some ways that we can decrease even that minimal pain. One is to try to schedule your mammogram mid-cycle. So if a woman has a 28-day menstrual cycle, you can try to aim for day 14. So that's day 1 being the first day of bleeding, day 28 being the last day before your next bleed. Aim for day 14, and that's when the breasts are the least hormonally influenced. And so it can help to minimize whatever minimal pain you might experience with a mammogram. Another thing is certainly okay to take Tylenol or acetaminophen over the counter for pain before or after your mammogram, if you feel like you need that. And then honestly, going with a friend, making the experience maybe more pleasant, planning a lunch date afterwards can always sort of make it a more social outing. And then one last thing is there is a vendor specific technology. So instead of the normal mammogram, which is, a flat plate, there is one that's curved like the breast. And so it is vendor specific, but if your imaging center were to have that, women do report decreased pain with that, understandably, since instead of using something flat on a round surface, you're using something round. So if your imaging center has that, that might be able to further decrease the already minimal pain from a mammogram.
That's good to know. And I think honestly, so I have had one very recently, and because my mother had breast cancer, so I've, had a couple of screenings, but ultimately it was so fast that it was like not even a problem. Like yes, it is uncomfortable for like a couple seconds, but it's so fast. And knowing that you're clean of cancer is just so well worth that minimal discomfort. I mean, think of all the things you do in a day that cause you discomfort, right? You work out, you diet, you do all these things that are very uncomfortable. Like this is nothing compared to those things. So really, absolutely, strongly recommend getting one. And I
Absolutely.
guess, in the same setting, like, what if someone, people are like, well, do I really have to get the mammogram? Can I just get an MRI or just an ultrasound? Do we have to get a mammogram? Can we do something else?
So that's a great question. So mammogram is the screening study that is good for the whole population. And why do I say that? Well, when we talk about screening for anything, not just breast cancer, but for anything, we want it to be something that is accessible to everyone or to a large majority of the population, something that is cheap, right? Because we want it to be affordable. We want to be able to pay for this. Luckily, screening mammograms are something that are covered by our insurance. We want it to be quick because the longer it is, the harder it is to get someone to do it and to do it on a large population. We want it to be easily performed, et cetera. So all of these things, basically what we're saying is we want something that is accessible to as many people as possible. And that's what a mammogram is. A mammogram is basically an X-ray, although a fancy X-ray because it now predominantly uses 3D technology. But it's an X-ray of the breast. It is a very quick exam. It is affordable. Again, it's covered by insurance. And even most people who might have some physical limitations are able to obtain a mammogram. Obviously, there are still going to be some situations where that's not possible, but for a vast majority of the population, they are able to have a mammogram. And the statistics of a mammogram, so the sensitivity, the specificity, the amount of cancers that it's able to detect are also good. So it detects 6 to 8 breast cancers per 1,000 women screened. It has specificity and sensitivity in the 90% range, which is considered good for a screening test of any kind. So understanding that some people find it painful or that mammograms are perfect, can you go without a mammogram? The answer is no, but you can add something else if you're looking for an extra layer of either supplemental screening or just that extra layer of protection. So if a mammogram detects 6 to 8 breast cancers per 1,000 women screened, there can be a few extra cancers per 1,000 women screened detected by ultrasound. That's a whole breast ultrasound. And it's not better or worse than mammogram, although technically it does find less cancers, but it is using a different technology. It's looking at the breast an entirely different way. So mammograms are using light technology or the X-rays. Ultrasounds are using sound technology, and they just look in the breast a different way. They can be good for women who have dense breast tissue to, again, detect an additional 3 breast cancers per 1,000 women screened. But those are done along with mammograms. Some women will do them at the same time, like same day. Some women will alternate every 6 months. So mammogram today, 6 months from now, an ultrasound. And then the gold star evaluation is an MRI. So MRIs double the level of breast cancer detection, up to like 15.5 to 16 breast cancers per 1,000 women screened. So why isn't that something that we offer to everybody? Well, it doesn't meet the criteria that I had said before. It's not quick. It's not accessible. It is expensive. It's not easily performed. The government actually puts a limit on how many MRI magnets can be in a certain area, and that's a government thing. And it's not covered by insurance. It's certainly not covered 100%, and in many cases, it's not covered at all. Now, do we continue to work to try to change that and make it more accessible? Absolutely. But for now, when we talk about breast cancer screening for women as a whole, mammogram fits the bill. MRI and ultrasound are something to be done in addition to mammogram. An MRI is a fantastic option for women who are at high risk. Again, have a BRCA mutation, have extremely dense breast tissue, have a strong family history, et cetera. And something that they should definitely be exploring with their physicians.
That's great. That's really helpful. And yeah, I think and MRIs are long. They take a long time. So like
Yeah,
if you're going to go through an MRI, I've not had one, but when we counsel our patients, you got to kind of sit still in this tube for quite a bit of time. So not
right.
the ideal thing for something where you want to screen for a cancer.
Exactly.
Yeah. And then what about, breast exams? So my doctor stopped doing breast exams because there was data saying that breast exams don't help. So should I still do breast exams or should I just not worry about it?
So great question, and of course a controversial one. So when we talk about breast exams, there's of course our self breast exam that we're doing for ourselves, and then the clinical breast exam. So the self breast exam is something that's recommended monthly, whereas the clinical breast exam is once a year. And the reason that there's even been any controversy around it is because there are predominantly a large number of false positives, i.e. a woman will say, I feel something, or a doctor will say, I feel something in my patient. And we go on to do imaging and show that it's just normal tissue. And as great as that sounds, like, yay, there's nothing there. It's not like I want to find breast cancer. But when we talk about the utility of something, it's showing that, okay, well, we're mostly just finding these false positives and not really benefiting patients as much. However, we do know that there are plenty of breast cancers diagnosed in women who are below screening age. They have no family history. They have no reason to think that they would need high risk screening like we discussed earlier. But their cancer will develop before the age of 40. So when I find breast exam to be most impactful is in those ages and populations. So we recommend a clinical breast exam and a self breast exam to start in our 20s, definitely by 25. And the things to keep in mind. So I recommend, again, mid-cycle exam. So as we referenced earlier, if you have a 28-day cycle, day 14, again, your breasts are the least hormonally influenced at that time. And so it can help minimize any normal hormonal fluctuations that we would have. Now, when we are in our 20s and 30s, we have a lot of hormones in our body. So we are always going to have some level of hormonal influence. But again, doing day 14 helps minimize that. So I recommend a monthly mid-cycle exam, and I recommend that you get to know your normal. Knowing your normal will help you understand and recognize when there is a change. Not everything that we feel is going to go on to be something, as I already said, most are false positives. The other thing is if we do identify something, if we feel a lump, it's important to take note of the position, the size, whether it moves or is mobile or it's fixed. And then I recommend only feeling it once per week for a full cycle. And that will help minimize those false positives for, hey, I feel something, I should go see my doctor right away. Now, if something is changing rapidly, obviously we should bring it to the attention of our doctors and providers. But if it's something where, hey, I think I feel something, take note, make some notes in your phone if you have to, like, this is where I feel it, take some pictures if you need to. And then a week later, feel it and say like, wait, okay, it's still there. It's still, a pea size or whatever. Feel it again for a full cycle. I cannot tell you the number of times that my patients will come into me and say, well, I felt something 2 weeks ago, but it's gone now. And I like, they're scared. They think they need to go in right away to the doctor. And that is not always true. And so for most regions of concern per a self-exam, they could go away. In terms of the clinical exam, like it had been mentioned, same for false positives. But I think that self-breast exams and clinical exams still have an important part for women who are below screening age. I never want to dismiss their concerns. My saying to wait a month is not like, oh, you probably don't know what you're feeling. It's me saying, based on the statistics, based on women of reproductive age having a lot of hormonal influences in our bodies, it is quite possible that it will resolve. And if not, then absolutely you should be obtaining, further care and possible imaging.
Great advice. Great advice. So tell me, the other thing I've heard a lot from patients is they're really worried about the amount of radiation they're getting from a mammogram. Like, will that cause cancer? I mean, that much radiation every year seems like a lot.
Right. And so I understand the concern, but the good news is absolutely not. It's totally safe. So as you can see by my fake background, yeah, my fake background has me in San Francisco. And if I were on the Golden Gate Bridge, I don't even know if they allow that anymore, but if I were a pedestrian on the Golden Gate Bridge, I'd be getting a lot of sun exposure, even if I had my SPF on and everything. We are still exposed daily just by, being a planet orbiting around the sun, et cetera, to background levels of radiation. So there's a certain amount of radiation that is just considered normal background every day. And then there's a limit that the FDA places on how much they consider safe, whether through imaging, background, work exposure, et cetera. I, as a radiologist, am exposed to radiation, for example, because I'm doing things under X-ray or under fluoroscopy that expose both me and my patient to radiation. And so the amount of radiation from a mammogram is considered safe by the FDA. It's well below the limits and standards that they set for what should be exposed within a year. And another helpful example, again, I'm in San Francisco. I'm actually based in DC. If I want to take that flight between DC and San Francisco, or hey, I want to go see the Eiffel Tower, I want to go from DC to Paris, the amount of radiation I'm going to get just from being in a plane that's that much closer to the sun and doesn't have all that ozone, all those different layers to protect, I'm actually going to get the same amount of radiation from that flight as I would from a mammogram. So I certainly understand concerns about radiation. The radiation from a mammogram is not going to be causing cancers. It's completely safe. And again, I'm never going to say no to a flight to Paris, and I'm also never going to say no to a mammogram.
Awesome. Wonderful. Let me just see if anything else. Lastly, so last question I have is, obviously younger women tend to have more dense breasts, or some women have implants. How does that affect mammograms? Should those, obviously, I think we've covered that everyone should get a mammogram, but is there some specific things that those people need to consider?
Great question. So, two different discussions. So number one, yes, everyone is eligible for a mammogram with, very few physical exceptions. For dense breast tissue, the standard old school mammogram was a 2D mammogram, just like a chest x-ray. It was an x-ray of the breast. And that did have some limitations for women with dense breast tissue. But now we have a 3D, excuse me. Now we have a 3D mammogram that takes images.
Take a second. It's okay.
Okay. So now we have a 3D mammogram that takes a series of images through the breast. So instead of just that straight on view, it's actually looking at the breast page by page like a book. So instead of looking at a book with the cover closed, it's opening it up at each page, and it's better for women who have dense breast tissue. And then, like we were talking about before with the ultrasounds and the MRIs, those can be good supplemental tests for women who have dense breast tissue. They can help look at the breast in a different way and increase the breast cancer detection. When it comes to implants, or mammograms are totally safe for those who have implants, whether it's in front of or behind the muscle. So some implants are what we call prepectoral or subglandular, and that means they are inside the breast itself. And then some implants are placed below the pectoralis musculature. So they can make, the ones that are inside the breast or prepectoral can limit our detection of breast cancer because they might obscure the adjacent tissue. And even those that are behind the muscle, if they're not easy to push back, which our technologists are totally skilled and trained to do, if they're not as easy to push back, then we know we could be missing some of the tissue. But they are still completely safe for women to be getting. And for any woman who feels like they might have decreased detection or a suboptimal mammogram because of it, MRI is always going to be an option.
Great. Awesome. Well, that is so great. Is there any myths that we might have missed? Something that you hear more, or that you hear people thinking about mammograms, but that's completely false?
People who think that they don't need a mammogram because of a lack of family history. So we know that that's not true. People who think soy isn't safe. So that's not mammogram specific, but we know that soy is totally safe. And otherwise, I think we covered it. Oh, and then deodorant does not cause breast cancer either. The reason that we have to remove it when you have a mammogram is because it can get into that tissue. Just by putting it on topically, it can sit on the skin and it can mimic a calcification that might be something more concerning. So we like to just be able to have these clear, clean images, so we're not dealing with any kind of artifact or anything that might mimic or obscure our ability to detect breast cancer.
Great. Wonderful. So I hope we've, allayed a lot of fears about mammograms. It is an excellent test, a very useful test. Everyone needs to have one after 40, some people even sooner. So please get your mammograms, and absolutely don't be afraid. It's not scary. You're not getting too much radiation. It's not going to be pain for too long. It's very, very fast and very efficient. So thank you, Dr. Malik, for joining us. And thank you, everybody, for joining us live on FemHealth, for you by doctors. And as always, remember that the FemHealth doctors are here for you and your families.
Bye.